Good morning, guys. How are you? Today we will continue our HSC training sessions, and in this training session, we will go for the first aid. What is the first aid? It is a immediate medical treatment which you give to an injured person before the arrival of a specialist medical team. When a person get injured in an organization, there are many things which can occur with that person. Maybe he get unconscious, maybe he have broken bones or injured parts of the body, maybe he can have a fatality. So when you give uh, treatment to an injured person, what you need to do, you have to go through some steps. These steps are very important steps, and they are categorized as A, B, and C. What is A in this step? This is called actually open the airway. When a person get injured or he get unconscious, this portion of the body, this throat get like this in this position. So what happen? He cannot breathe. So you need to open the airway of that person. How you can open the airway of that person? You need to take your two fingers, keep it at under the chin, and move it a little up so that his airway, the throat airway, gets open and he can breathe. He can have the oxygen for breathing. Second, we go for the B step. What is called B? B is for the breathing. What is the breathing? In the breathing, you need to check the person breathing. How you can check? You can check his chest movement. You can place your cheeks near his nose to feel the air coming out from his nose, and you can place your fingers near his nose to check. So you can easily check from that this person is breathing or not. Then we go for C. This is called cardiopulmonary resuscitation. What is this? This is an artificial way of breathing. This is an artificial way of breathing. Uh, how you can give this breathing? You know, you have to let the person lie down on the ground. This is the chest. You have to make a center point on the chest. Here you have the lungs. So when you what you need to do, you need to place your palms like this in this position on the chest of that person, in that position where you make a intersection point, and press it 30 times. After 30 times pressing, giving a compression of 30 times, what you need to do, you need to close his nose, place a mouthpiece or some cloth on his lips, and give him two mouth breaths like a blow. This is the position of that person. What you need to do for the other step, if that person is not revived, you have to go it continuously, do the same procedure, 30 compressions, two mouth breaths, and then what you need to do at that moment, you have to go these compressions, 120 compressions in 1 minute. This is the proper step. But you know, when you are in a condition of a trouble, you cannot properly attend. So why we call this procedure, this steps, why we utilize these steps? Because you need to keep him revived till the arrival of a medical specialist team. Then we go for the other steps of the first aid conditions. Maybe you have the broken bones. For example, if you have a broken bone, I will take an example of a finger. What you need to do, you have to place some hard thing on the both side of the broken part, and wrap it with the dressing. The other step is that if that person have broken leg or have shoulders, you have to keep him outside of this position. You have to go through the same position which I have told you, to keep the purpose of attaching these solid parts on the broken part of the body is to avoid the mobilization, uneven mobilization of that part of the body which is broken. Then we go for the cuts. If you have the minor cuts, you can apply the saniblast. If you have the minor cuts, you can apply the saniblast. But if you have cut more than 1 inches deep, what you need to do, you need to apply a dressing on that portion of the body which has bleeding. Then you have to, if the blood not stops, what you need to do, you need to not unroll the dressing, you have to apply another dressing on that dressing, because when you try to remove this earlier dressing, previous dressing, what will happen, the human body has a specific feature that when the blood comes out from any part of the body, it will get clot and make a spot. But when you remove this part of the dressing, what happen, this uh, clot will removed, and again the blood will start flowing out of the part of the body. So you need to apply some pressure and apply the dressing on that part of the body. Other thing is that the choking means your throat is choked with something if you eat it, or if you swallow it. So at that time what you need to do, you have to go behind that person and make a fist like this and push him like this to move this thing which is trapped, or to make a pressure here which will travel from here and put a pressure on the thing which is choked inside your throat and move it out from the mouth of the person. So this is for the choking. Sometimes you have to make a tap on the back of that person to move it out, the thing which is choked. If the other thing is that for the first aid case, if something go inside your eye, a metal piece or something, do not try to rub it, or chemical. If you have a chemical, try to wash it clearly. And if you have a metal piece go inside your eye, and then what you need to do, you need to stay and keep for the medical attention team, which will come and make a treatment for you at that time if you need some hospitalization or something like this. The other thing is that. The other first aid case is the in fire burns, the burns from the fire. So at that time, what you need to do, if you have a burn, there are three types of burn: first degree burn, second degree burn, and third degree burn. First degree burn, if you have some that type of burn, keep your part of the body underneath the water for 5 to 10 minutes to keep it cool down. If you have some bruises, this is the second type of degree. If the bruises comes with the black spots on the body of the skin, or the skin, or your skin melts, at that time what you need to do, you need to go for immediate medical treatment to come and let you take to the hospital for the further treatment. If a person get fire on the whole part of the body, try to keep this fire under control. How you do it, you wrap a blanket on the person body, or roll him on the ground so that the fire cuts off. As you know that fire, what is a fire? It is a combination of three things: air, fuel, and ignition. If any part of this triangle is cut off, then the fire will be immediately removed. So do not try to use any kind of another thing to stop the fire. Just wrap him with the blanket which is inside the first aid boxes. Later on I will tell you about the brief things about the first aid box, what are the items need to be kept in the first aid box. So this is all regarding to the first aid. That what is a first aid? It's immediate medical treatment given to a person to keep him revive under the arrival of a medical specialist team. The thing which I've told you that I will discuss about the first aid box is that this is a box in which there are mandatory items which are kept for the revival of the person at that time, at that spot, to keep him alive. So what are these items? There are dressings inside this one. There are Caesar. There are Saniplast, adhesive plast inside this one. There is mouthpiece, which one before I told you, when you give a CPR to a person, you must have a mouthpiece. Then you have ice cold packs. This is for the fire burns, to keep the body temperature cool down. Then you have the splinters. Splinters have to keep the fracture part of the body straight. When you apply the splinters, this part of the body will not mobilize if it is broken. And other things are tapes, which are used to in make a, to keep the dressing tight, and to apply it on it so that it cannot be easily removed. Other thing for the first aid boxes which are mandatory when you are doing a job in a specialized areas, so some more items are added, but the mandatory items which I have told you are the same to keep in the first aid box. Later on in the next training session this years we will discuss about the crane lifting operations. This is a very interesting session, and please listen this session for the effective operation activity. Thank you.